That is one issue that we believe, unfortunately, could have been managed in a more constructive way, because we have no doubt that the intentions of Ms. Asopari are constructive, but we believe that it coming out to the press and at the same time the political parties having to pick up on the intentions from the press lessens the impact and the possibilities for a committee to be bona fide and previously discussed, previously reached consensus in order to establish guidelines and remits, so that the committee is not just an empty vessel and a fait accompli that the parties have only found out about through the press.
You say that committees without political consensus are a waste of time. So does that mean you won't be supporting the GST's proposal for a select committee on mental health?
No, absolutely not. Together Gibraltar is all about cross-party collaboration and consensus and working together. What we say is that, in particular, on the issue of mental health, it is a topic that has so many far-reaching ramifications and implications, and it's an issue where social policy of the different parties can have massive impacts on mental health. For example, the GST's position on women's reproductive rights is one that deprives women of their human rights and of widespread consensus politically, socially, and scientifically. So, and on the other hand, the GSLP's exacerbated construction and development economic policy can also have an impact on mental health, just like the deprivation of the GST's one on women. So we have fundamental political differences already before we come to the table on an issue as wide-reaching as mental health. So this is why it's so crucial to understand each other's position and see if, despite these differences, we can find a consensus in order to work towards a future in a cross-party way.
You say that politicians shouldn't intrude on the job of medically trained professionals, but the examples that you've just cited, abortion, construction, those are political issues, aren't they?
Of course they're political issues, but they are issues that are very much standalone issues that each party has put out their views and their ideologies upon. In terms of mental health, anything and everything can impact mental health, and it's a medical condition which is impacted by social factors, and this is why I am interested to understand whether the best way forward for a select committee would be to have it full of people in the medical profession, doctors and other medical experts. And if that is the case, how can we equip that select committee in the best possible way? And this is why we believe that in principle we support it, but a lot more discussion has to come from it before it gets presented to Parliament.